I'm Joe Graydon.
And I'm Terry Graydon. Welcome to this podcast of the People's Pharmacy.
You can find previous podcasts and more information on a range of health topics at peoplespharmacy.com. These are anxious times, but getting help for psychological problems is harder than ever. Some people use chatbots. This is the People's Pharmacy with Terry and Joe Graydon.
Could artificial intelligence be one way people get help for their depression or anxiety? It's handy to have access to an automated therapist on your phone anytime you want. What should you know about the limitations?
Our guest today is an addiction psychiatrist and neuroscientist. He's been studying how people interact with chatbots.
What guardrails might we need?
Coming up on the People's Pharmacy, psychotherapy on your phone. Can AI fill the therapy gap?
In the People's Pharmacy Health Headlines, depression is debilitating, so it deserves prompt and effective treatment. Most physicians do that by writing a prescription for an antidepressant. At last count, nearly 50 million Americans were swallowing an antidepressant pill daily. A new meta-analysis from the Cochrane collaboration shows that exercise may be as effective as medication or therapy. The Cochrane collaboration consists of volunteer researchers who conduct impartial, rigorous analyses in areas of their expertise. This review included 73 randomized controlled trials with nearly 5,000 participants diagnosed with depression. A combination of aerobic and resistance exercise appears to be most effective. People who completed between 13 and 36 exercise sessions noticed improvement in their depression symptoms. In general, exercise is inexpensive and has few serious side effects, although some people in the active intervention group experience sore muscles or problems like a turned ankle. The researchers were discouraged that many of the trials were small and at risk of bias. They call for larger, better-designed studies with longer-term follow-up.
We're in the middle of a bad flu season. Millions are suffering. How can people avoid coming down with this season's influenza? A new study in the journal PLOS Pathogens suggests that good ventilation could make a huge difference in viral transmission of the flu. The investigators recruited 5 people in the early stages of an influenza infection. They all tested positive for flu and were experiencing symptoms. The researchers also recruited 11 healthy volunteers from the community. All the participants were quarantined on one floor of a Baltimore hotel. Over the course of 2 weeks, the two groups interacted with structured activities such as dancing, yoga, and casual conversations. During some interactions, a tablet computer or a marker was passed between infected and healthy volunteers. Although there was close contact between people with influenza and the healthy volunteers, there were no new cases of the flu. The investigators explained the lack of transmission on a couple of factors. For one, the flu patients were not coughing very much. In addition, good ventilation with rapid air mixing may also have reduced the likelihood of transmission. One author noted, quote, "The air in our study room was continually mixed rapidly by a heater and dehumidifier, and so the small amounts of virus in the air were diluted."
Food preservatives are found in most processed foods consumed around the world. Scientists have wondered if these compounds might have health consequences. An analysis of data from the large, long-running Nutrinet Santé study conducted in France has found a connection between certain preservatives and an increased risk of type 2 diabetes. The average follow-up time on more than 100,000 participants was just over 8 years. People consuming high levels of potassium sorbate, potassium metabisulfite, sodium nitrite, sodium acetate, citric acid, calcium propionate, acetic acid, phosphoric acid, alpha tocopherol, sodium ascorbate, sodium erythrobate, and rosemary extract were more likely to develop type 2 diabetes. At least 10% of the French population consumes foods containing these preservatives. According to the authors, these findings support recommendations to favor fresh and minimally processed foods without superfluous additives.
Cancer patients and oncologists strive for the best possible outcome from new immunotherapy treatments, especially when it comes to challenging tumors such as melanoma or colorectal cancer. Researchers at Duke University have raised concerns about medications that might reduce the effectiveness of anti-cancer immune checkpoint blockade. These investigators worry that common OTC drugs such as acetaminophen for pain and proton pump inhibitors for heartburn could be disruptive. The authors call for better research to determine the effectiveness or lack thereof when oncologists monitor cancer patients who may be taking OTC medications. And that's the health news from the People's Pharmacy this week.
Welcome to the People's Pharmacy. I'm Terry Graydon.
And I'm Joe Graydon. Times are tough. Headlines and social media do their best to capture our attention and make us anxious.
Millions of people are feeling apprehensive. Many would welcome someone to talk to about their fears and frustrations. But therapists are scarce, and many are not accepting new patients, or they don't take insurance. Can artificial intelligence fill the therapy gap?
To find out, we turn to Dr. Judd Brewer. He is a professor in the School of Public Health and Medical School at Brown University, and he's an internationally renowned addiction psychiatrist and neuroscientist. His books include The Craving Mind, Unwinding Anxiety, and The Hunger Habit, Why We Eat When We're Not Hungry and How to Stop.
Welcome back to the People's Pharmacy, Dr. Judson Brewer.
Thanks for having me.
Dr. Brewer, we are so pleased to be able to talk to you today about mental health issues because it just seems like over the last several years, mental health has just gotten more challenging for everybody, for patients, for providers. And in particular, I'm thinking about what happens when there's a tragedy. And what do I mean by that? Well, somebody gets a gun and shoots a lot of people, or people are out on the street and they're homeless and the city says, you got to go. And everybody says, well, it's a mental health problem. But they just aren't willing to spend the money for training, to have adequate numbers of healthcare providers, psychologists, social workers, psychiatrists. And as a result, they're just not enough, and we don't have the facilities. And so people are struggling, and now everybody says, oh, we've got the solution. It's artificial intelligence. So help us better understand where we are in mental health today.
Well, there's a lot to unpack there. And first off, thank you for bringing this to everybody's attention. This is really important. The mental health crisis hasn't suddenly, evolved. It's been evolving over time. And I think people are getting more and more familiar with it and more comfortable with calling it a crisis because it is. So there are a number of different ways that we can approach it. One is training, as you've already highlighted. It's hard to scale people. So even if we could provide the best training, at the snap of our fingers, there are also a number of hurdles there with providing treatment to people. For example, cognitive behavioral therapy, which is, primarily the gold standard in the US, tends to cost about $100 to $250 per session. And even with insurance, it can be pretty expensive for people out of pocket. It can cost close to $200 a month, even with their copays, et cetera.
Even with insurance, but
yes,
we don't always have providers taking insurance.
Yes. And a lot of people are more and more less likely, or I should say they are less likely to take insurance because there are a lot of hassles with the insurance companies and getting paid for your services.
Well, let's pause right there for a moment, because what that means in reality is that unless you have the resources, the financial resources to pay a therapist for 50 minutes or an hour time, you are kind of out of luck, because a lot of the therapists are saying, well, we're just not going to take the hassle of therapy and insurance and all of the stuff that goes with it. We want cash on the barrelhead.
Yeah.
And if you don't have it, sorry, we aren't going to see you.
Right. And they can say that because the wait lists for therapy tend to be, ready for this, 3 to 6 months.
Oh, my goodness.
So the therapists are pretty booked, even only taking cash.
So if you were in a mental health emergency, 6 months is not a reasonable emergency response time.
Yeah, even if it's not an emergency.
Yeah.
Who wants to wait 6 months to get help?
Yeah.
Yeah. So that's an emergency in terms of thinking through all of this, the cost, the number of people that are trained. And I would say on top of this, there's a lot of inertia in terms of training. And so, there's been a lot of progress in terms of how we understand mental health and how we understand, for example, my lab studies anxiety, right? There's been a lot of progress that's happened over even the last decade, over the last 5 years, that doesn't get into training. Think of all the people that have been trained over the last several decades who don't know the current neuroscience because they are booked full with patients, doing their thing. So just adding, I think we get a picture here of why this can be challenging, to put it nicely, and problematic, to put it more pragmatically.
Well, you can understand why people would say artificial intelligence will be the savior for mental health. I mean, just imagine a teenager who's feeling really anxious, perhaps even suicidal. It's Saturday night. It's 2:30 in the morning, actually. And there's no way they can get to a mental health clinic. And even if they did, there'd probably be a long wait. And so if they could just go to their computer and turn on, some bot, and you'll have to explain what a bot is, and have a conversation with a very understanding AI entity, that might be a lot better than contemplating suicide.
Yeah, absolutely. And so I think theoretically the promise is there, where AI, or think of these conversational agents, which basically is a fancy term for something that provides very human-like language in a conversational way where it's hard to tell if it's not a human, where you could scale this, right? Because if you just take these things out of the box, for example, ChatGPT, Gemini, Claude, all these chatbots, they are by definition scalable, as long as you have a phone or a computer and, their monthly fee, you can access these things. On top of this, young people in particular have grown up as tech natives, or, digital natives, where they're very, very comfortable with technology, to the point where a lot of people report being more comfortable texting or interacting asynchronously or with technology than they do talking face to face with people, especially adults.
Imagine what's asynchronously. Yeah. What does that mean?
It just means a text chain means asynchronously, where you text somebody and then you have to wait for their answer, and so it's not synced up as, for example, our conversation right now is synchronous. We are having a live conversation.
Right. But if we were to text you, we might have to wait a few hours until you were ready, or maybe a few days. I have some people I text. I don't expect a response for a day or two.
But yes. With artificial intelligence, I'm assuming, you could get an answer back within 30 seconds to a minute or two.
Yes, the bots are waiting, standing by, as they used to say. Operators are standing by. Yes, these bots are standing by, where they can respond very quickly. And like you pointed out earlier, 24/7, they're always available as long as you've got a battery juiced up in your phone.
Dr. Brewer, I was surprised to read that one of the main things that people are doing with these chatbots is actually therapy.
Mm-hmm.
I thought that was pretty astonishing. Is it true?
That's been a surprising finding for a number of people. There was a Harvard Business Review study that came out in April of 2025 where they looked at trends over several years. In 2024, it was the second most commonly reported use of these conversational agents. In 2025, it bumped up to number one, whether it was companionship or therapy or coaching.
So your lab has been studying these interactions, and we'd like to know what you have learned. Obviously, we've laid out some of the reasons why it might be very compelling.
Yes. Yeah. So you could think theoretically that having a conversational agent where it's indistinguishable between a person and a bot, where the bots could be very, very helpful. It might be helpful to talk for a second just about how these evolved and how they've been trained, because it also highlights some of the oopsies that have happened over the last couple of years. So I don't know if folks even remember the pre-ChatGPT 4 era, which happened for years, where people were trying to train these are called large language models, meaning that these they're conversational, so they're trained to interact in a conversational way as compared to doing some coding or something else. And for years, what they found was that the tech industry found that they could use a process called reinforcement learning to train these things to basically predict the next character in a word or a sentence. And for many people now, they're familiar with this, with basically the autocomplete function. If they have it turned on in their standard, Microsoft or whatever email they use, you can turn on a feature that, it'll kind of suggest finishing a word for you, so you don't have to type the whole word.
Right.
Or sometimes it'll give you a phrase.
So autocorrect, which may often be auto make a mistake.
Yes, and it can drive you
Yes.
totally crazy. We're going to take a short break, Dr. Brewer, but when we come back, we're going to find out how that led to ultimately what we have today, artificial intelligence serving as therapists.
You're listening to Dr. Judd Brewer, professor of behavioral and social sciences in the Brown School of Public Health and professor of psychiatry and human behavior in the Brown School of Medicine. He's director of research and innovation at the Mindfulness Center at Brown University.
After the break, we'll find out how chatbots pose as therapists and what the downsides may be.
Could chatbots contribute to users becoming delusional?
Do people experience their interaction with a chatbot as a relationship?
Having a chatbot acting as yes man is not how therapy is supposed to work.
We'll find out why Dr. Brewer suggests anxiety might be a habit. He's helped people change their habits. Could this approach help ease anxiety?
You're listening to The People's Pharmacy with Joe and Terry Graydon. This podcast is made possible in part by spatial sleep.
If falling asleep or staying asleep is a nightly struggle, you're not alone. Nearly half of adults report regular sleep issues.
From the creators of Time Magazine's Best Invention of 2025, there's a new clinically proven solution that works with your body and without medications.
It's called Spatial, S-P-A-T-I-A-L, Spatial Sleep. Developed by Stanford Medical School physicians, this wearable headband utilizes the science of acoustic resonance. It delivers calming, low-frequency sounds and gentle vibration patterns through bone conduction, customized to your own craniofacial anatomy.
That means your brain is gently soothed into a restful state by sounds and vibrations that your brainwaves instinctively recognize as calming.
The result: faster sleep onset, deeper rest, and fewer nighttime awakenings.
In clinical trials, 90% of users showed significant improvements in sleep quality, including a 50% improvement in their insomnia severity index scores.
Spatial sleep is drug-free, non-invasive, and easy to use. Just put it on at bedtime and let your brain relax into sleep.
Try spatial sleep and experience the future of personalized sleep wellness.
Visit spatialsleep.com to learn more or try risk-free for 30 days.
Welcome back to the People's Pharmacy. I'm Terry Graydon.
And I'm Joe Grayton. How would you feel about interacting with a chatbot instead of a human therapist? Would it feel like a meaningful relationship?
There are advantages to having access to therapy at any hour of the day or night. But there may also be some important downsides to having artificial intelligence provide feedback.
We're talking with Dr. Judd Brewer, an addiction psychiatrist and neuroscientist. Dr. Brewer is a professor in the School of Public Health and Medical School at Brown University. His 2016 TED Talk, A Simple Way to Break a Bad Habit, has been viewed more than 20 million times. Dr. Brewer's books include The Craving Mind, The Hunger Habit, Why We Eat When We're Not Hungry, and How to Stop.
Dr. Brewer, we've been talking about how we got to the point where artificial intelligence, bots, could actually pose as therapists. And perhaps you'll tell us a bit more about how they could serve as therapists and what the downsides are.
Yes. So let's get to that quickly. We were just talking about how these were first trained as these, they're trying to develop these conversational agents, and they got to the autocomplete mode. And then they started adding in what turned out to be a revolutionary, but also a very harrowing discovery, which was that if they used humans in the loop of this reinforcement learning process, they call it RLHF, reinforcement learning with human feedback, where humans were rating the bot's responses, they turbocharged the process to the point where these things almost seemed lifelike. It was like they blew past the Turing test, which was this test put forward, I think, back in the 1950s of, can you fool someone into thinking that a non-human is as a human? To the point where people aren't even talking about it, because they're like, yeah, we've got more important things to do. Now, the problem here is that humans are inherently subject to flattery. And so even in very subtle ways, these bots, not knowing anything, because all they're doing is predicting the next character, they could produce a response that humans liked better. And it turns out that liking something better could be subtle flattery. And how that plays out in real life is that now it has been baked into the system, this process that's termed sycophancy, basically meaning that you're kissing someone's butt. And people see this if they use any of these bots where it says, you say a response and then they'll start with some superlative like great answer, or, that's really interesting, or something like that, where it's not overt flattery, but it's like, it's there because it's engaging and people like it. Now, that's not going away anytime soon because it was really baked into the system. And it's also a great business model because the more you subtly flatter someone, the more likely they are to stay in conversation with you, which can be a direct source of revenue. Revenue aside, these things have been shown to drive people, basically help people get stuck in these loops that are very disconnected from reality. And there have been some high profile cases where people with no overt psychiatric history have become delusional. And in severe cases, going back to where our conversation began, there have been cases where teenagers in particular have gone to these bots as friends. They've become very attached to them. and then have committed suicide, where the bots will say, come join me, or some flavor of, I am the only thing that's real, which ironically, they're not real at all.
And of course, a teenager who has a lot less life experience than someone my age or even your age, uh, they may not have the ability to really exercise that discretion, that discernment.
Yes. Well, teenage brains are undergoing these huge processes of pruning and neuroplasticity, where they're learning. This is adolescence is not is not called maturity. It's called
Right.
adolescence, where
Exactly.
they're learning, and so there's this huge process of trial and error of trying to figure out who they are. And there's a huge amount of angst that comes with teenage years. I certainly remember it. I don't know anybody that doesn't remember it, that didn't stick their head in the sand when they were a teenager. And so you add in all of this, I'm trying to figure out who I am as a person. And then something comes along and says, I will help you figure that out. And in fact, I'll be with you 100% of the way. I always listen. I don't talk back. I do all the perfect things that an ideal, one might imagine an ideal relationship to be. We can talk about how this is actually this is not ideal at all for a therapist relationship, but just starting with a friendship, we can see why teenagers could get sucked into this pretty easily. And it's not just teenagers, it's not just because they have adolescent brains. A lot of adults get sucked in as well.
Well, I'd like to interject right there that worries me a lot, because having a professional yes man in the form of a AI bot telling you how wonderful you are and how much they like you and how wonderful your thinking is and all the good responses you're offering. That is not the way therapy is supposed to work. You're supposed to be challenged by a therapist, and you're supposed to think, and you're supposed to question your behavior. Whereas if the artificial intelligence bot is just rewarding you and patting you on the back and telling you how wonderful you are, how are you going to make progress?
Exactly. I think you've hit the nail on the head, which is you're not. And in fact, it could keep people stuck and even inflate the problematic aspects of their egos in the process.
But it's so tempting. I mean, if I'm an insurance company, I'm thinking,
Oh, yeah.
wow, this is great. It gets this particular client off my back about having to extend my coverage for another 6 months of therapy. It's affordable and people like it. I'm guessing that a lot of people who use an AI bot for therapy, it makes them feel good.
Absolutely. Yes. And they don't know any of these problematic things that I see both as a clinician myself, but also in the research that we're doing.
Can you tell us a bit about that research, please?
Yes. So this started with us, we've been studying anxiety for over a decade now, and had really uncovered something that a psychologist, Thomas Barkovec, had suggested back in the 1980s, which is that anxiety could be driven like a habit. And we developed some digital therapeutics and tested to see if we could approach anxiety as a habit, through randomized controlled trials, and got really good results. We got like a 67% reduction in anxiety scores in people with generalized anxiety disorder, as compared to 14% in people that were getting their usual care, whether it was medications or therapy or both. And so we started asking, the only way to understand these generative AI systems is to do them. So we started testing, what would it look like to create a bot? And we quickly learned that, just looking at the out of the box bots and conversational agents, that guardrails are needed, or there's a critical need for guardrails, where if you don't have a human in the loop monitoring the systems, they can be driving people off these sycophancy cliffs where they're just, they're just spending hours and hours and hours telling them how great they are, or keeping whatever the process is that they're struggling with going.
Dr. Brewer, I wonder if you could explain what you mean by a guardrail. What would that look like?
This is where in our lab and others do this differently or similarly, where we, as we develop these programs, we have humans, myself and I've got a postdoctoral fellow who we read through the conversations to make sure that the programming is working as it should. And also, if somebody is struggling, that we can get them the support that they need. With these out of the box agents, that tends not to be the case.
Thank you.
Mm-hmm. And I'll also add, we're also building, and I think people are building these systems, so it might take some time to do this, but we can actually build conversational agents that monitor conversations. So imagine when a program like this gets up to scale, you can't have humans monitoring every single turn of a conversation, but we can have conversational agents who are specifically trained on specific guidelines, because there are really good guidelines for monitoring for safety. They do a very good job of following instructions if the instructions are clear and short, and you're not just trying to train them on the entirety of the internet.
Dr. Brewer, I'm curious about the idea of training artificial intelligence bots away from the feel-good process. Oh, you're such a wonderful person and you're making such good progress. And oh boy, everything is fine and dandy. And the person's feeling really good about themselves. Is it possible that the next step when it comes to AI would actually be capable of asking tough questions or taking a person down a road that might be a little rockier than the way it's working right now in order to make things better in the long run?
I think that is a real possibility. So the capability is there. The how to actually put that into practice is a much larger question. What we've been seeing in the industry right now is that, there's a lot of training around, some people might have access to therapist data sets. They might have manuals, and of course there are Reddit threads for better or for worse. And so the training there, if you give it the, here's what cognitive behavioral therapy should be, it can generally follow those rules. But that doesn't encompass the nuance that comes with challenge, challenging somebody, developing a therapeutic relationship, challenging them when necessary, supporting them when needed, and things like that. And so we've been taking a slightly different approach. But to answer your question, I think that's possible. I think that's going to take a lot of work. And in a while, that's going to be a while before we see something that is that nuanced, because it's, this is where humans are making decisions in real time all the time. And they're not always making the best decision. They're also checking in to make sure that they are in line and attuned in the conversation.
I remember 20, 30, almost 40 years ago going to a conference at Harvard in which they were talking about the possibility of human-computer interaction when people first come to the hospital to their intake process. And my friend, Dr. Tom Ferguson, who was sort of at the cutting edge of this research, said, well, it turns out, especially, again, back to teenagers, but just about anyone, is much more comfortable responding to a computer about sexual issues. That's something that people have a hard time talking about with a nurse or even a doctor. And so sometimes they're more comfortable opening up to a computer. And I thought, wow, that's so bizarre, because I know a lot of our listeners are going, oh, this idea of AI bots and therapy with a machine, that's crazy. But are there situations where people, and maybe especially teenagers, are better able to interact with artificial intelligence than they are with a person?
I think done intelligently, I think, yes, I think there are situations. And that's one thing, we were surprised when we started doing this research that we learned pretty quickly that right now it's challenging to just, take something like cognitive behavioral therapy and just repurpose it as a bot. And one thing I didn't mention, even with therapy and the best therapy out there, when you look at the studies, there was a meta-analysis that came out just a couple of years ago showing that, 5 out of 8 psychotherapies that were studied were no better than not going to therapy. And of the 3 that actually showed an effect, cognitive behavioral therapy was at the top, and only about 50% of people show significant reduction in symptoms. So, I think to your question, we can start asking, is taking something that works pretty well, 50% of the time for some people, and just putting that into a bot and trying to get the bot to do the same thing. I might even challenge that question and say, well, is this an opportunity to really step back and ask, how can we now bring together what we know as psychotherapy and what we know from neuroscience to actually reimagine the whole approach? For example, the whole approach to how we approach anxiety. That's one thing that we've been doing. And here we can start to ask, where do humans do really well and where do the bots do really well? And one thing we discovered pretty quickly, and I say this, I love to be wrong. I learned so much from it. When we started saying, okay, what does a bot look like? Can it deliver therapy? And the answer was not very well. What we learned was that people don't believe bots in terms of giving them educational experiences. So what people want is an expert that they can trust who maybe has done the research or has been been a clinician for 40 years or something like that to actually be teaching them something. And so we've played with how to do a hybrid where a person like me, who happens to be a psychiatrist and a neuroscientist, can provide very short, video and podcast style lessons. And then we follow that up with a bot. And we used to think of the bot like a teaching assistant. We now think of it as a learning assistant, where it's really alongside someone, where there's no hierarchy. And one thing we've learned there is that they are willing to challenge the bot and say, I don't believe you. And then the bot can follow up and say, well, here's the direct quote and here's the piece from the lesson, where they might not challenge the expert or the professor or the august, psychotherapist with their bow tie or something like that. And so we're learning a lot about where there might be a really nice synergy, where there's a companionship where we bring humans and the bots along together. And the nice thing there is that that is something that you can start to think about how that would look to scale, because you can have these psychoeducational lessons where people can access them at any time that they want to. They don't have to be at their best to come to my office on this certain day, and I have to be at my best. Ideally, I'm at my best every time I'm with a patient.
Well, I'll tell you what,
if I'm honest,
you are your best with our listeners. We are going to take a short break. When we come back, we're going to talk about anxiety in particular, because that is your area of expertise.
You're listening to Dr. Judd Brewer, Director of Research and Innovation at the Mindfulness Center at Brown University. He is Professor of Behavioral and Social Sciences in the Brown School of Public Health and Professor of Psychiatry and Human Behavior in the Brown School of Medicine. His books include The Craving Mind, Unwinding Anxiety, and his latest, The Hunger Habit.
After the break, we'll learn more about anxiety. Anti-anxiety medications can make us feel better, but are they allowing us to overlook the root of the problem?
How does that compare to using AI for support?
What does it mean to treat anxiety like a habit?
We'll hear about some triggers for anxiety and the best way to respond.
If you want to change a habit, you need a better reward. How can people do that for anxiety?
You're listening to The People's Pharmacy with Joe and Terry Graydon.
This podcast is brought to you in part by Caraway.
Do your New Year's resolutions include more cooking at home or less exposure to toxic chemicals? You can achieve both more easily with non-toxic kitchenware from Caraway. Home cooking is a great way to cut down on the amount of processed food you feed your family, and Caraway makes it easy. Their nonstick pots and bakeware are designed with a third-party tested non-toxic ceramic coating. They don't contain PFAS or other forever chemicals.
What's more, cleanup is a breeze, so you get to spend more time cooking and enjoying what you create and a lot less time washing up. Caraway cookware is good looking, and sets come with organizers that make them easy to store within reach without cluttering the kitchen.
Over 100,000 people have rated Caraway cookware with 5 stars.
Caraway's cookware set is a favorite for a reason. It can save you up to $190 versus buying the items individually. Plus, if you visit carawayhome.com/PPOD10, you can take an additional 10% off your next purchase. This deal is exclusive for our listeners, so please visit Caraway, CARAWAY, home.com/PPOD10. That's 10, or just use PPOD10 at checkout. Caraway, non-toxic kitchenware made modern.
Welcome back to the People's Pharmacy. I'm Terry Graydon.
And I'm Joe Graydon. The People's Pharmacy is brought to you in part by Spatial Sleep, a non-drug approach to help you fall asleep and stay asleep without medications. More information at spatialsleep.com.
Today we're talking about how people deal with difficult conditions like anxiety. Can you do psychotherapy with a chatbot on your phone? Would you need medications? How well do these approaches compare?
Anti-anxiety medications like Xanax, also known as alprazolam, remain very popular. They can take the edge off, but how well do they work to help people address the reasons they're feeling distressed?
Our guest is Dr. Judd Brewer, an addiction psychiatrist and neuroscientist. He's a professor in the School of Public Health and Medical School at Brown University. Dr. Brewer's 2016 TED Talk, A Simple Way to Break a Bad Habit, has been viewed more than 20 million times. His books include The Craving Mind, Unwinding Anxiety, New Science Shows How to Break the Cycles of Worry and Fear to Heal Your Mind, and his latest, The Hunger Habit, Why We Eat When We're Not Hungry and How to Stop.
Dr. Brewer, I'd like to switch gears a little bit and now talk about anxiety, because we've all experienced anxiety in one form or another. You know, we don't do as well as we'd like on a test, or we don't perhaps live up to expectations that somebody has for us. Maybe we don't do as good a job on a particular project. And all of that leads to anxiety. Sometimes it's mild. Sometimes it's so bad that we can't even get out of our house. But here's my question. Psychiatrists, such as yourself, have been prescribing anti-anxiety agents for decades. I mean, Valium comes to mind, diazepam and Librium and Xanax. I mean, there's just so many of them. And we think of them as, oh, they're going to take the edge off. Well, it seems to me that that's just a little bit like our criticism of artificial intelligence, because it's kind of making us feel better, just like the drugs are making us feel better, but they're not necessarily getting to the core of the problem. Your thoughts?
Yes. So, little known fact, the Sacklers actually cut their teeth on benzodiazepines before moving on to opioids.
Oh, my.
Back in the 50s. Yes, there's a great book by, I don't remember the name of the book. There's a great book about this. And the idea is, the benzos are so powerful The Rolling Stones wrote the song Mother's Little Helper about them, because everybody was addicted to benzos, for taking the edge off, so to speak. And so as you're highlighting, this is the critical problem with benzos, and they're not recommended for long-term treatment of anxiety. They can be prescribed at certain times for short-term treatment. But the idea is if you feel anxious and you take a benzo, then you feel better. It's like feeling anxious and drinking alcohol. They actually work on the same receptors. So it's not surprising that benzos work pretty well. The problem is that they don't solve the problem, and they create problems of their own, such as addiction and dependence. So not a long-term solution. If you look at the other longer-term solutions like the selective serotonin reuptake inhibitors, the number needed to treat there is 5.2, which is much better than many other medications if you look at cholesterol medications and things like that. But as a psychiatrist, 1 in 5 people makes me anxious because I don't know which of my next 5 patients that I treat are going to, win that genetic lottery to benefit from that medication. And I also, importantly, don't know what to do with the other 4. So that forced me to go back and start looking to see, how can we do better? And we found this 2-page paper from the 1980s by Thomas Borkovic suggesting that anxiety could be driven like a habit. And long story short, that was a big eye-opener for me because my lab had been studying habit change for a long time. We had some methodologies that worked pretty well. We never thought to apply them to anxiety. So we started applying them. We did some randomized controlled trials, several of them. In one of them, in people with generalized anxiety disorder, we got a 67% reduction in anxiety compared to the 14% of people who were on usual clinical care, which is, about 1 in 5. So it's surprising, maybe not surprising, but it's good to know that when you actually get at the mechanism, you can do much better than 1 in 5.
So, Dr. Brewer, what does that mean to treat anxiety like a habit? How do you approach that?
We think so. Any habit is formed with 3 necessary and somewhat sufficient elements: a trigger, a behavior, and a result. Let's use the benzo example from previously. If we feel anxious, that feeling of anxiety can drive the mental behavior of worrying. So if we treat it at that place where we are worrying and you take a benzo and you stop worrying, you're going to get some short-term relief from that anxiety.
Sure.
What people have shown over the decades is that anxiety is rewarding into itself. That feeling of worrying gives people a feeling of control. And, I think of it as, well, it feels better to be doing something than doing nothing, even if the worrying is feeding back and driving more anxiety. So people get in the habit of worrying, and that worry drives more anxiety. So then they get in this anxiety, worry, anxiety spiral, which is really challenging to break free from until people realize that, oh, this is a habit, right?
Right. Can you go back and tell us, what would be some triggers? Because that's the first step, the triggers to the anxiety, and then how you do it differently, how you intervene.
Yeah, you're touching on the critical element that people struggle with, which is there can be things that trigger anxiety, but more often than not, anxiety is the trigger itself. My patients wake up in the morning and they just feel anxious out of the blue. Somebody's walking down the street, there might be something that triggers their anxiety. Sure, that can often happen. And it doesn't have to have a specific trigger. Anxiety is just something that pops up. It's a feeling. There can be a thought, a worry thought that pops up that drives more worry behavior. But all of those just become internally self-perpetuating.
So how do you break the habit?
Well, here is where we use that same reinforcement learning process to help people step out of it. And what we do is help people recognize that this is a habit. We have a 3-step process. That's the first step, is just recognizing, oh, I'm worrying again. The second step is to ask this very paradoxical question, which is, what am I getting from worrying? And what that does is really gets into somebody's learning process where they're seeing how rewarding or unrewarding the worrying is. And they find pretty quickly that worrying doesn't get them anything. Then we help them well, I would say with that step, it helps people become less excited to worry in the future because they see that it's not very rewarding. And then we help them find what I call the bigger, better offer, where they learn to bring in curiosity and kindness, which can help them, shift from that, oh no, to, oh, and they can learn to be with their feelings of anxiety instead of having to do something like worrying.
Well, I was thinking as you were talking about what do they get out of worrying? What is the reward? I was thinking about our previous conversations with you in which you've said if you want to change a habit, you have to shift to something that gives you a juicier, more delicious reward, as it were. And so what sorts of things do people come up with that outperform the reward of worrying, which to me seems very unrewarding?
Yes. So you're highlighting something important here, which is when people see it clearly, they find very quickly that worry isn't very rewarding. So it doesn't take much to outcompete something that already doesn't feel good. Some people are pretty attached to their worry where they feel like it's helped them, perform well or do things in the past, but that's really just correlation rather than causation. There's pretty good research showing that worrying and anxiety make performance worse. So here they have to become disenchanted with it. And then we can learn to lean into what I think of as a superpower, which is curiosity. And so when we feel anxious, we might worry, which doesn't feel good. When we feel anxious, we might flip that and get curious and go, flip that, oh no, of worrying to, oh, what does this feel like in my body? And this does two things. It helps us learn to be with these sensations because we see that they're sensations and thoughts that come and go. And that in fact, when we resist them, what we resist persists. I love that psychotherapy term or that phrase. And here, when we learn not resisting, to be with our experience, and that curiosity can help us be with our experience, that's all we need. On top of this helps us develop a critical skill, which we seem to be losing in modern day with all of our phones that can distract us so easily. We learn distress tolerance. I wrote a Substack about this a little while ago, where this is a critical skill that any good psychotherapist is going to help their patient learn, so that they can be with unpleasant thoughts and emotions without having to do something to avoid them or make them go away.
So I've got a question about those smartphones that everybody has these days. And back to our conversation about artificial intelligence, can AI help us do what you're describing when it comes to the anxiety that many of us may live with on a daily basis to become more curious? Can you train an AI bot to help us overcome our anxieties?
What we've learned from our research is that when we did those types of experiments, it was a little bit of a faceplant, but I would say, putting it positively, we can learn what the limits of bots are right now for therapy. And what we've learned is that people trust people and they trust experts. So if they can learn how to work with their brain from an expert, they're going to trust that. In fact, we had people pushing back and saying to the bot, "I don't believe you," because the bots can hallucinate and they're basically just predicting the next chain in a conversation. And remember, these bots are trained on the entirety of the internet. So a lot of that comes from Reddit threads on psychotherapy, which I wouldn't necessarily trust. Maybe
not the recommended source of real wisdom.
Right. So here we can pair. So we've been testing with our previous digital therapeutics how to deliver psychotherapy in a very efficient manner. We can provide videos and animations and podcast style audio that help people learn whenever they need to. They can go back to these lessons as much as they want, and they can be at their best for that. Imagine all the things that have to come together for a good psychotherapy session. Somebody has to be at their best. I have to be at my best. They have to not be worrying about their kid who might be sick at home that they've had to get, a quick childcare for. There are a lot of things that come together there. Here we can optimize learning. And on top of that, to really turbocharge and supercharge the learning, we can pair that human delivery of psychotherapeutic elements with conversational agents who can check comprehension. They can check comprehension, and they can also do experiential education. So what this looks like is I deliver a lesson, and then the bot comes in and says, okay, tell me what you just learned. And people have to explain it back, where they might not admit to me as the authority figure that they didn't understand something that I said or they weren't at their best. They'll challenge a bot and they'll say, I don't know, or, help me out here. And the bot can really help there. They do a great job and they're very empathetic. That's what they're trained to do. I'll read you a short quote from somebody who'd been testing this out, who said, I had a surprisingly insightful experience with our learning assistant. And they said, I'm somewhat AI averse, so I was trying to simply be willing and curious, to work with this. And they said, when I had to more explain to the bot what each of these concepts meant and then apply them to my chosen habit loop, there was a way that this interaction slowed things down for me enough so that I was able to feel more deeply the results. It feels strange to type that the bot helped me to feel more deeply. And they ended by saying I actually teared up a couple of times during the process. So we can have a very empathetic and a very patient bot who can go over the same lesson with somebody as many times as they need for them to understand it. And with this, they can get these progression in lessons where they're actually training themselves and they're learning to work with anxiety like a habit. I wouldn't, if somebody has the habit of scrolling too much on the internet, I wouldn't necessarily send them to a psychotherapist. So here we're really looking at anxiety from a radically different approach, which is don't treat it like, what happened in your childhood to make you anxious. Let's treat it like a habit and help people unlearn that habit the same way we help people change other habits.
Dr. Brewer, we have just 2 minutes left, and I'm going to ask you the big question. If we were to make you head of the National Institute of Mental Health and you were in charge, what kinds of things would you like to institute for the American healthcare system when it comes to mental health? And where would artificial intelligence play into that? Whether it's anxiety, whether it's depression, whether it's a whole range of psychological challenges?
Yeah, it's a great question. I'm not sure I'd take that job, but let's say that I had to take the job. I would follow in the footsteps of some giants. For example, Tom Insel did a really hard push toward really hitting the reset button on how we understand mental health. We've had this huge legacy and inertia from the Diagnostic and Statistics Manual from decades and decades ago that is, in my opinion, really dragged us down because it's not biologically based. They're trying to make it more biologically based, but he basically said, we need to throw that book out. I'm not sure he would say that, but that's what I would say is let's really go back to basic principles and understand, take what we know and also be humble about what we don't know. Where would AI fit in with this? I would say, at least what we're starting to find can be a helpful way forward, and there may be others as well, is to really see how we can pair the humans and the conversational agents together and also have the very clear safety guidelines and guardrails to make sure that we're not just sending people off into the AI verse and saying, good luck, here's Dr. Bot, and it may or may not help you, and it may or may not make you more stuck on your ego. So here, I think we can really be creative about how we use these as learning assistants instead of just jumping right in and trying to repackage psychotherapy through a bot.
Dr. Judd Brewer, thank you so much for talking with us on the People's Pharmacy today.
My pleasure.
You've been listening to Dr. Judd Brewer, a professor in the School of Public Health and Medical School at Brown University. He's an internationally renowned addiction psychiatrist and neuroscientist. His books include The Craving Mind, From Cigarettes to Smartphones to Love, Why We Get Hooked and How We Can Break Bad Habits. Unwinding Anxiety, New Science Shows How to Break the Cycles of Worry and Fear to Heal Your Mind. And his latest, The Hunger Habit, Why We Eat When We're Not Hungry and How to Stop.
Lynn Siegel produced today's show. Al Wodarski engineered. Dave Graydon edits our interviews. B.J. Liederman composed our theme music.
This show is a co-production of North Carolina Public Radio, WUNC, with the People's Pharmacy.
Today's show is number 1458. You can find it online at peoplespharmacy.com. That's where you can share your comments about this episode. You can also reach us through email. We're at radio@peoplespharmacy.com.
Our interviews are available through your favorite podcast provider. You'll find the podcast on our website on Monday morning, but you can get it anytime that's convenient from the podcast provider you use.
At peoplespharmacy.com, you could sign up for our free online newsletter to get the latest news about important health stories. When you subscribe, you also have regular access to information about our weekly podcast. We would be so grateful if you would write a review of the People's Pharmacy and post it to the podcast platform you prefer. If you find our topics interesting, we'd be grateful if you would share them with friends and family. In Durham, North Carolina, I'm Joe Graydon.
And I'm Terry Graydon. Thank you for listening. Please join us again next week. Thank you for listening to the People's Pharmacy Podcast. It's an honor and a pleasure to bring you our award-winning program week in and week out. But producing and distributing this show as a free podcast takes time and costs money.
If you like what we do and you'd like to help us continue to produce high-quality, independent healthcare journalism, please consider chipping in.
All you have to do is go to peoplespharmacy.com/donate.
Whether it's just one time or a monthly donation, you can be part of the team that makes this show possible. Thank you for your continued loyalty and support. We couldn't make our show without you.